Hey, it's Ashley from Demystifying Your Health. Welcome! I'm so glad that you're here today. In this episode, we're going to be talking about your spleen. Sure, you know that you have a spleen, but what does it actually do? And why is it such a problem if something happens to it? Let's find out. Before we can get into what conditions affect your spleen, we need to understand what your spleen is and does. It's located in the upper left part of your abdomen, behind your stomach, underneath your ribs. This helps keep it protected. It's usually about the shape of a fist and about 4 inches long. While it has multiple roles, its main job is filtering your blood, and this is important because it helps your immune system. It filters your blood and removes old red blood cells, which carry the oxygen, carbon dioxide, nutrients, and waste throughout your body. And it produces and stores platelets, which help your blood clot, and white blood cells, which are the immune cells of your blood. It also specializes in fighting certain bacteria that can cause pneumonia and meningitis. So as you can see, your spleen is an incredibly important organ. When it comes to your spleen, there's 2 main things that you should be concerned about: an enlarged spleen and a ruptured spleen. Let's go over enlarged spleen first. When your spleen's enlarged, it's also called splenomegaly, and this means that your spleen actually increases in size. It's not always a problem. It can indicate that your spleen is doing its job of filtering the blood, but it can be just overactive, which is known as hypersplenism. Some other causes can be viral infections like mononucleosis, parasitic infections like toxoplasmosis, bacterial infections like endocarditis, leukemia, which is cancer of the blood, lymphoma like Hodgkin's disease, inflammatory diseases like lupus or rheumatoid arthritis, cancer, a cyst actually on the spleen itself, cirrhosis, which is chronic liver damage, or trauma to the spleen. The issue is when your spleen is enlarged, it makes it more likely to be injured because as it increases in size, it extends down past your rib cage, so it's not as protected. This is a problem because your spleen has a lot of blood that filters through it, so when it gets injured, it can actually cause a significant amount of blood loss. The other main issue with your spleen is a ruptured spleen, and this is a life-threatening emergency, so it needs immediate medical treatment. It's usually the result of trauma to the area, but other causes can be glandular fever, like viral mononucleosis, or blood diseases, like hemolytic anemia, or even malaria. It doesn't happen initially. It usually takes a couple of days or weeks before it actually occurs. There are a couple of other conditions that can affect your spleen, like sickle cell anemia or thrombocytopenia, which is when you have a low blood platelet count because your spleen's enlarged and actually storing excessive amounts of platelets. Asplenia is the absence of normal spleen function, and this increases your chances of having an infection. Hyposplenism is reduced functioning, but not quite as severe as asplenia. The next step is to determine what type you have, if you have an enlarged spleen or a ruptured spleen. With an enlarged spleen, symptoms are rare, but if they do occur, you might feel like you can't eat a large meal because there's pressure on that part of your stomach. You can also have discomfort or fullness in that upper left part of your abdomen. Sometimes this radiates up to your left shoulder. And the pain can be worse if you take a deep breath. With a ruptured spleen, you're definitely going to have pain in the upper left part of your abdomen, and it will go to your shoulder. You could also have blurred vision, lightheadedness, confusion, fainting, nausea, anxiety or restlessness, paleness, an abdomen that feels hard or swollen, and signs of shock, which would be that your blood pressure drops suddenly, your heart rate increases or drops, and the person's going to become drowsy and might actually lose consciousness. Obviously, as you can see, this is more of a life-threatening situation, and therefore it needs to be treated immediately, as we said before. This is more of a longer duration event. It's going to not necessarily appear right away, and you might not even know that you have it. The only true way is if you've had a illness that could cause this. When it comes to treating either an enlarged spleen or a ruptured spleen, the treatment courses are incredibly different. Usually with an enlarged spleen, your doctor will take a wait-and-see approach. They're just going to see if you get better, but during the meantime, they're also going to tell you to limit any activities that could cause a rupture, such as participating in contact sports or anything like that. However, complications of an enlarged spleen could lead to you needing to have your spleen removed. The only treatment for a ruptured spleen is an emergency surgery to remove your spleen and control any bleeding. It's important to note that while removing your spleen obviously is life-saving, it will affect your life going forward because you're going to need to take certain vaccines and medications because your body will no longer be able to prevent certain infections because you don't have a spleen. This is why it's very important to make sure you know the risks before you have surgery. In some cases, obviously, though, it's not really an option. You have to have the surgery. When it comes to preventing an enlarged spleen or a ruptured spleen, the list could be endless because of the fact that there's so many conditions that can affect your spleen. The two primary things are to not let infections go untreated, especially if you know they can cause problems with your spleen. The others, be examined by a doctor if you have an injury to the area of your spleen. This way you'll be able to be monitored if something changes. Your spleen is an incredibly important organ, and you need to take care of it so it takes care of you. Thank you for joining me today. Please like and comment below and share us on your social media pages. Stay healthy.